Each year, a team of volunteers travels across the globe to the city of Mbarara in western Uganda. They will spend a week performing surgery on women affected by fistulas.
What got me coming here to begin with was about 12 years ago, some physicians at UCLA wanted to start a fistula program in Mbarara. And they needed a senior fistula surgeon to teach them, as well as the Ugandan physicians, how to repair fistulas.
Fistulas can be caused by obstructed labour. They cause incontinence, infections, and other serious symptoms. In Uganda, half of all births take place outside of a hospital, and fistulas are common.
The prevalence is about 2%. That means for every 100 women delivering, about 2 women get the fistula. In Uganda, things which to do with the reproductive system, the private person of a female, are really sacred. So no woman can come out to say, I have a problem like this. They will be stigmatized, they will be isolated. How can you be leaking urine, leaking stool? So they are divorced off by their husbands. They are neglected by the community. So they are in shame, they live in shame. So they can't come out to say, I have such a problem, because it's shameful.
I bring physicians, anesthesiologists, nurses, techs, and then there are people taking care of the logistics of the camp. Medlend every year brings not just people, but the supplies necessary for the surgeries. Surgical gowns, the drapes, the anesthetic agents, the needles, the drugs, the antibiotics, the pain meds, the sutures, all of the necessary supplies are needed to perform surgeries.
Conscious of the scarcity of supplies, the Medlend team is careful to bring a surplus of everything they'll need. Medlend invests in infrastructure at the hospital. Medlend provided the anaesthesia machines and tables used in the operating theatres. Medlend also provided the funds to build the new, dedicated gynecological ward where patients who attend the fistula camp recover after surgery. Although conditions at the hospital can still be tough, these investments represent a huge improvement to the lives of patients and staff alike.
Yeah, we've come a long way. The first time in 2009 we had tents, very thick tents, military tents. We got them from the Red Cross across there. It was a challenge to the patients. They would stay in these tents would be so hot. Staying in them would be so difficult. When it rains, the rainwater would sieve through. So until we have this new home of ours, which Medlend's been part of in the construction, and now it's pretty decent enough. I think you have taken pictures of patients there. It's quite decent accommodation. Yeah.
It's absolutely beautiful. Yeah. Funds provided by Medlend have allowed our Ugandan colleagues to embark on an ambitious programme designed to tackle the causes of fistula. A combination of radio broadcasts which heighten awareness of fistula and education programmes for health workers are already paying off.
And the women are now getting information that they need to be delivered in hospital under skilled attendance. Yeah. So that's why the prevalence was high, but now it's going down low.
That's brilliant.
Yeah.
That's brilliant. And that's a result of work you've been doing.
Yeah, absolutely. We have done this. When we started, we'd get over 100 women coming to get fistula repair. In one camp, we couldn't finish them out. More than 100, we couldn't take care of work there. But now, at least the numbers are going down. We now did about 50 women, so the numbers are going down.
Things are improving, but the problem is far from solved. Uganda still doesn't have enough surgeons trained in fistula repair. The team from Medlend will return next year and the year after that to train the next generation of surgeons and to work alongside our Ugandan colleagues. Ensuring that each patient gets the surgery she needs requires long hours under difficult conditions.
It has to be done. That's it. I mean, the patients have to be cared for, and that means we push as hard as necessary. That's just a fact of life. You know, it's uncomfortable. It's hot. It's humid. There's no AC. There's no fan. The windows aren't open. It's hot. It's yucky. But if that's what it takes to take care of a single patient, then all I can say is just sweat away. You know?
For me, it's finally what's the outcome. If you have a woman came in agony, woman came in dejected, smelling urine, smelling stool, going back home dry, a woman again, for me, even if I work 24 hours a day, it will be satisfaction. That's all the satisfaction I need. And that's to be part of a team which is having a change in women's life in Uganda. That's the best satisfaction I'll ever get. That's what I take away from it.
A return with a full tank of gas, a full soul of happiness, a full feeling of contentment. That's it.
Through the dedication of our colleagues in Uganda, the commitment of our volunteers, and the generosity of our donors, Medlend has helped hundreds of women. Thank you for being a part of that.